Today we're going to talk about one very important concept in full arch, which is minimizing cantilever. When we look at our occlusal anatomy, we can appreciate that bulk of our occlusal stress comes from these premolars and molars. Therefore, the longer the cantilever is, more stress most distal implants will get, therefore decreasing the longevity of the implants in the case due to bone loss and complication around the implants. Traditionally, we were taught that you could do a sinus lift and place implant, but when we look at 20 years, 30 years, oftentimes we notice that the bone around the implant that we grafted, that we created, unfortunately does not last as long. Therefore, oftentimes I consider zygomatic or pterygoid, and pterygoid could come very handy, and this is a case I recently did where we did a pterygoid implants on both sides, and you can see it completely eliminates the cantilever, maximize the longevity and survival of this implants, which should be a great service for the patients who are looking for a lifelong solution through full arch treatment. I oftentimes explain to the patient as when we're building a table, you want all 4 or 6 legs to be as far apart as possible. Oftentimes, it's pretty easy to make this left and right legs, in this case implants, to be as far as possible, but because of the sinus anatomy, we find it difficult for those implants to be as far apart, especially the posterior ones. But try utilizing pterygoid implants to maximize, to spread those legs on our table, which is in this case occlusion, to increase the longevity and stability of your case.